if I was just to focus on something that, I think about a lot, which is law and social movements, and I've reflected a lot in the last few years about, of the reproductive rights movement. And I think one of the interesting dynamics of what happened with the reproductive rights movement since Roe is that it became extremely legalistic, that we took all of our battles to court, that it became about expert lawyers, and it stopped being about grassroots activism. And I think, the thing that really struck me in watching the movie was how much Francine, you are sort of taking this movement back to its roots, with Judy and others, having this past of a grassroots movement, of questioning authority, of challenging laws, not relying so much on the laws, but in fact sort of working around them and disobeying. And the word civil disobedience came up so often. And I think it's important to return to those roots. And when I taught reproductive rights right after Dobbs, I went around the room and I asked my students, where were you when Dobbs happened? And everyone had a very powerful story of the moment they heard that the decision had come down, and when it was leaked, and they called their mothers and they cried and they spoke with their community members. And one student, and I'll never forget this, she said, I ran out onto the street thinking everyone was going to be on the street, and I was just standing there by myself. And I thought, this is like a sign of what's happened over the last decades, that we didn't all run out into the streets immediately, and I feel like you're taking us there, and thank you so much. And it was really a pleasure to watch the movie and see all the people who are doing all the brave work that's happening.
I think somebody said in the movie, what a tremendous sort of, the shift in the whole landscape paired with COVID presented an opportunity, and that, you've been thinking about this forever, but I think it wasn't in a lot of people's worldview, or, honestly, 20 years ago, I never thought that, thinking of how far we had to come to get mifepristone, all restrictions, what it was even like to offer it in a clinic, the idea that we would ever have telemedicine, that we would ever have online abortion seemed so outrageous and far-fetched, that the fact that we have come to this point is remarkable. And then COVID and the data that has been generated to actually document the safety has been impressive and convincing. And I think there have been so many steps forward that it's now incontrovertible. And I think that it was impossible to imagine that before. And I think this is the beginning of the democratization of medication abortion, which is pretty amazing.
My first thought watching this was, oh my God, Francine. Francine and I have been in so many places, same tables, talked about other things, but this side of you is, for me, a young feminist advocate, speaks volumes and is encouraging and gives hope. What do I think? I do work in a clinic, or I did work in a clinic where I saw only refugees, asylees, immigrants, and their families. And if you hear me speak, you can tell I'm foreign born. And I do understand their struggles and the notion of health literacy. When the Dobbs decision was overturned, I was in Cleveland. Judy and I had spoken at Radcliffe about abortion, and I said to that audience then that I worry that this is going to happen, and when it happens, it's going to impact people of color and those from marginalized backgrounds differently. And I was in Cleveland trying to convince colleagues about how do we provide culturally appropriate reproductive health and sexual reproductive health services to refugees and immigrants and asylum seekers who have a history of trauma. Really, I had this cool presentation and then walked out, and the decision had passed. The first thing I did was to walk to the federal building to join whoever was there. I brought my kids who were with me, and my husband who always thinks I'm crazy. And since then, it has been sad to watch. It drove me back to do a PhD. And I mean, again, what this film speaks about, it does touch, I mean, I like what Loretta Ross said, but it does touch the basic struggles that I see every single day in practice. For people who can't go on a website and read the English language to order these pills in the mail. Sometimes I've reached out to Judy and said, well, I need to organize transportation for this woman who needs to get an abortion. And for people who choose to have tubal ligations, but someone decides that they can't have it, well, because they're young or because they just don't understand their options, and so they get to walk out of the room with an IUD and not know what they have inside themselves. And mostly to me, as a woman who comes from outside of the country, it speaks about how much you have walked so backwards in time and influenced many other parts of the world. We've done abortion underground in other parts of the world where it's illegal, and I just never thought it would be in the United States. And so this film puts it right in perspective, and it's a call to action for all of us to do what we can, really.
I'm going to take this opportunity to bring everybody's comments together. And Massachusetts, you heard at the end about the Shield law in Massachusetts. Massachusetts is one of the states who passed the Shield law, back to the issue of how it's all about lawyers and how we have to fight, and the issue of trying to wrest it away from the medicalization that we had done to this very easy product that actually it was women who had figured out that they could just take these pills and self-managed, and we managed to restrict it by putting it in the hands of the medical profession, and we had to undo that. And the point that you're saying about self-care, all of that is a part of this story. I think the most amazing part of what we are, since this film was finished, the film is now 2 years old, it's amazing, back to what's legal, mainstream, valid, normalized. We just had data that came out from a very important study that shows that 1 out of 6 abortions in the country now are done by telemedicine with pills shipped. This is in the entire country now. 1 out of 6 abortions are telemedicine abortions with male pills. This is amazing, as you point out, that we've gotten that. That's one of the stories. The other story is that thanks to these providers that you saw, and there are more now, and thanks to the lawyers and the advocates who have stepped up to pass Shield laws in as many states as we can. So far we have 6 states that will shield any provider that is working out of those states. And thanks to that, we now have 15 providers working for 3 different organizations who make it so that I can tell you that today, it doesn't matter what state you live in. Don't listen to the news, don't listen to Arizona telling you we just passed this crazy law. In Arizona, in every single state in this country, you can get these pills mailed to you by a clinician, the FDA approved pills, 3 days, 150, and if you can't afford the 150, they'll ship them to you for whatever price you can do it. So the equity of access has been achieved. It's totally amazing. And really, frankly, it is at this point, the issues, we'll leave it to the lawyers to duke it out as to whether it's legal or not legal. But the providers who are doing this are doing so legally in the states that they're doing it. And people are getting this in the hundreds of thousands, okay? So these providers, the ones that I just mentioned, we know for a fact that just they are providing now $12,000 a month, but in the red states, okay? Into those states like Louisiana, Alabama, you name the state, I'll tell you there are pills being shipped there. People have now begun to hear that this is an option. I will make one last call, which is the next step, and Loretta said it the best. She said it. It's if you don't know that this is an option, you can't take advantage. The next step now is to share the word, is to let people know this option exists. All these providers have worked so hard and are taking so much risk to have made it happen, but unless people know, they can't access it. So that is your job. Your job is to let everybody you know about the Plan C website. Go to the Plan C website, do the drop-down menu on whatever state it is, learn what it is, learn about all of these amazing organizations. There's many, and I'm looking at, you know who I'm looking at? I'm looking at IBIS, I'm looking at, If, When, How. All these organizations that have come to be, they're all on the website. If you need help with legal, you can find out where to go and you will get your help. If you need with research, you will get the right person. If you need lawyers, they'll get a pro bono now. This is not going to go very far. The threat of putting you, by the way, and I'll end there. Yes, I promised to end there, Lois, thank you. By the way, they deputized everyone around the country with a promise of $10,000 to come after me. I put my name up there, I'm out there, I'm public. Nobody has, okay? There has not been a single lawsuit for aiding and abetting. This is what I mean about the fear factor. They're using fear, but if people step up, we can do it. So please do it. Spread the word. Put it in your medicine cabinet. Buy it.